Perfect. I am starting yet another video on the same day. I have found a very nice response and I continue doing this. I wish I could do this. Maybe I will do for, maybe I will not. Whatever I am doing right now is what I am doing. So I really hope this gets to some meaningful person or contributes to your journey in step 3 exam. Cutting everything short, let's get right into the video. On today's topic is going to be on a very simple yet complex topic in terms of CCS, that is irritable bowel syndrome. Any ideas that come onto your mind whenever you're seeing this case? Patient will present with diarrhea, constipation over 3 months. So it is inflammatory condition. Do ESR, CRPs to identify if there is any inflammatory component kicking in. Okay, and then you can always do urine analysis. Urine analysis is very important because in urine analysis, you can make out if there is any UTI. For all abdominal pain pathologies, don't forget to add on urine analysis. Our next investigation of choice is X-ray of the abdomen. Why to do X-ray? You can also do ultrasound, but then ultrasound will not give you the real reason behind constipation. So if a patient has constipation, you can do X-ray to identify stool accumulation. So any investigations can narrow down our diagnosis. Most of the times it can be just a stool impaction. There are cases there where patient can be frightened about having cancer, ulcerative colitis, Crohn's disease, and so on. So I just start with the basic tests. Make sure to do stool ova and parasites. You don't need to go with the stool cultures or anything like that. This one is to rule out pathologies like infections pertaining to diarrhea. And then we can do CRP levels, check the CRP levels. Again, this counts to inflammatory marker. Anti-gliadin antibodies. Okay, this is very important, guys, because we want to rule out celiac disease. Anti-gliadin antibodies, or you can also look for anti-endomysial antibodies. Whatever sounds good for you to remember, just make sure to type in onto the orders list endomysial antibodies. Now, sometimes we can confuse this with that of the lactase intolerance. So, for that reason, we are going to give a trial of lactose in the patient and see if there is any improvement or worsening of the condition. So, if it's worsened, we will directly know that the patient is allergic to lactase and is not making the lactase enzyme at first place in order to break down the saccharide into monosaccharide. So these are some important things that you may want to order. Apart from this, one of the most important and forgettable order on the list is Clostridium difficile infections. Do do add on this one in the list, because this is like the hospital acquired, right? So it can be pretty common. So because if this is coming positive, then everything else is just like not necessary. So you need to include C. difficile infection. It can simply turn out to be a complete different case that you might be dealing with. Yeah. Now coming to the treatment. In the treatment, what we are doing is, um, firstly for diarrhea, you need to evaluate how many episodes. If it is very severe, start with normal saline and admit the patient. If it is not that severe, then you can simply go with loperamide. Okay, for the loperamide and antispasmodic agents like hyoscyamide. Um, and then if the symptoms persist even after this, uh, keep in mind that you may want to give TCAs. TCAs on the back of your mind is something to just click right on spot. And the most important TCA that has been well documented is like imipramine. I like to write it down so that you can scan this in your mind and remember at that time on the exam day. And then what else? Yeah, that's it. So, in terms of preventive orders, you may want to tell the patient to exercise, because exercise is known to reduce the episodes. Lot of part of which is going to reduce the stress levels. So, one of the most important culprits behind this disease. So, just tell them to relax and have proper exercise regimen. Also, in terms of diet, there can be, uh, you can advise them to have low milk, cow's milk diet, because most likely it could predispose even if they are not allergic to lactose. Okay, so yeah, that brings us to the end of this video. So I have covered all the points here. Okay, so a list of investigations, treatment, and preventive orders. Yeah, and before we end on the video here, I also want to emphasize on the diet, on the lifestyle changes. Suppose in the patient you see modifiable lifestyle changes, then go ahead and address that, because smoking is really bad. So you may want to put in the preventive orders as early as possible before the case ends. I really hope that this video helps you. And do let me know if you want me to continue um, on these CCS cases, because I am thinking to kind of take a break, but then I will be motivated if there is anyone who is really getting benefited from these videos, and I would really be happy to connect. Okay. I wish you all the best. Thank you.